Hello, I'm Dr. Javed Butler. I just presented the results of the individual patient-level pre-specified pooled analysis of the Victoria and the Victor trial. As you know, Victoria trial assessed the impact of Vericiguat in patients with heart failure and reduced ejection fraction with a recent worsening heart failure event. And the Victor trial looked at the opposite end of the spectrum, again, heart failure with reduced ejection fraction, but without a worsening heart failure event. These were ambulatory stable heart failure patients. We pooled the data together on these two trials on over 11,000 patients randomized to Vericiguat or placebo. We looked at four separate outcomes: cardiovascular death, heart failure hospitalization, cardiovascular death, all-cause death, and the risk for heart failure hospitalization. And what we found that all four outcomes were statistically significantly improved with the use of Vericiguat, approximately 10% relative risk reduction. In addition, we also looked at a pre-specified analysis of NT-proBNP less than 6,000. Those patients tended to benefit more in the Victoria trial, and Victor trial is specifically focused on this group. In this overall population, almost 87% of the patients had NT-proBNP of less than 6,000. And in this patient population, all four outcomes not only were statistically significantly improved, but the benefit was even higher, with about 15% relative risk reduction for all-cause mortality and 17% relative risk reduction for cardiovascular death. And similarly, the benefit for the composite endpoint and heart failure hospitalization was also more pronounced. So in summary, in this pooled analysis of the two trials combined together, we showed that the use of Vericiguat in patients across the spectrum of NT-proBNP, across the spectrum of severity of the disease, especially in focusing patients with NT-proBNP less than 6,000. There was benefit for all-cause mortality, cardiovascular mortality, heart failure hospitalization, and the composite endpoint of cardiovascular death or heart failure hospitalization, providing us the opportunity with yet another effective therapy for patients with HFrEF.